Okay. All right. I'll see what was going on in the profile. Okay. All right. My pleasure. Bye-bye. Are you trying to get a refill? Oh, okay. What do you need a refill on? Do you want to keep that up? Sure, what time tomorrow?
Oh, sorry.
Okay. We open at 9, yes. Yeah, that's good. I'll put that in for you. Alright. What was the last name?
Fuad.
Have you been to the beach lately? Yeah. Because sometimes that salt water will do that. You know, like my friend is like real sensitive. But not salt water, not real loud.
Yeah, I can do that after I finish this.
Oh, okay.
Do more.
So, Lauren, when did you change
Can you verify your date of birth?
December 14th, 1988.
Alright. It's gonna have you sign the lowest keypad there. And then it's going to be 3. Do you need a bag for this?
Yes.
There you go.
Thank you, ma'am.
My pleasure. Hi. Here we go, bro. I've got 2% for you.
Okay. Because
Can you verify the address for me? 3151 Forum Drive. I'm going to ask for your signature on the lowest keypad there, and then it's going to be 1554. Oh, there's one question harder than that. Do you need a bag for this? Yes, please.
We're pulling in December, is that right? Or are we pulling October?
October. 6 months, right? Or is it 3 months? Have a great rest of your day. Thank you. Got one prescription for you. Can you verify the address for me? It's gonna ask for your signature on the keypad there, and then it's gonna be $7.50. There you go. Have a great rest of your day. Bye.
I have a pickup for Nancy Solomon, SALLMAN, 7551. And then I want to ask you too, if they're supposed to be checking in is when I can get my strips, my test strips and my lab tests. And they've been working with my other store, which is Bannerman, because they haven't been approved for Medicare Part B. It's been a nightmare. I've been trying to get these things for now 6 days. And I've not been, it was written last Wednesday. And I've been so frustrated. But I think you have the meter, but they were trying to work out when I could get the strips and the lancets.
What size strips are you needing? So there's 2 different sizes.
The ones that I don't know, the ones that I've had with my old machine were just the little, I don't know, the Ultra One Touch, but I don't even know what machine I'm on.
One's a 30 gauge and one's a 33 gauge. They canceled those out. Those are the lancets that have been canceled. And the test strips are in product They have a test that's ready to be ready tomorrow.
Yeah.
And then the Lancet.
No, I don't regret this at all.
Two water line 100, two water line 100.
I have full regrets.
It should be written in lots of 50 things.
That's everywhere.
It's been like every step of the way.
It is good for the child. It is pretty nice.
My most recent drive on it.
Your total is $5. Probably right now. There's both of your cards. There's the receipt. Both prescriptions are in the same bag.
I'm sorry.
Well, they have to do this every time. They have to type this stuff in. That's just how insulin type things are.
Yeah, nothing in the store. They said they don't even have the number yet for a Medicare.
They should.
Okay, you have a okay, you have a-
Especially for when you know. Yeah, I'm putting it in for you
All
right
right,
now.
she has one that's in process that we're not quite finished with. Yeah, if you want to just, as long as nobody comes up behind you, if you just want to sit tight, let me see if I can get it finished. I'm hoping. Okay. Is there something I can help you with?
Yes, I just want to get a consultation.
Okay, so you want to speak to the pharmacist? Is that?
Yes.
You don't
Okay.
want the lamp.
Give me just a second.
I got a consult down here.
I'm here. I've been waiting.
Hey.
I've been waiting.
Hey,
have a question?
yeah, I see you guys are busy. I'm so
That's
sorry.
okay, what's up?
So I got this medication. I'm just trying to see like what exactly should I be eating and how, what I should be doing exactly when I'm taking this.
Okay, so I would definitely eat when you take it. And then a full glass of water normally to help up with absorption. And then it can cause like diarrhea.
I've noticed that, like,
Yeah.
literally, since I eat something, like, it'll run through me like water.
Right, yeah, it can, if you have it to where it's like super severe, I would let your doctor know and see if they can call you in something else, just in case, because like some medications that are antibiotics can cause C. diff. It's like a parasite that can get into your system. It's like an overgrowth of bacteria, kind of, and it can cause like pseudocolitis, which can cause like upset stomach, really bad diarrhea, and that sort of thing.
Is that all it causes, or does it cause like more problems in the future?
Well, if C. diff goes untreated, then it can cause issues in the future. But most of the time, that's like the most extreme thing. Most antibiotics are going to cause anyone to have diarrhea. So unless it's like really extreme, you're going.
Because like literally, it'll run through me like water, like literally like as if I'm peeing through my anal cavity.
Right.
And then I'll clean myself up real good. I'll take a shower. I'll sit down, and then literally within a few minutes, my stomach just starts bubbling again.
Right.
And
how many times have you taken this?
So I'm on my 11th dose.
Yeah. One tablet by mouth. One.
This is a new prescription.
You're just taking it one time a day?
No, the prescription that I got from my primary care physician, it's the same thing, but it says Westward on it. But I took almost the same thing, doxycycline hyclate, 100 milligram tablet, about a month ago, and I noticed I was getting diarrhea also.
But you're only taking it one time a day?
Well, it says once every 12 hours on the other bottle. This one says take
one a day for 30
one
days.
time for 30 days.
So I would just try and see if it helps since you're not taking it twice a day. But if
This one looks different though. The other one is like a teal colored capsule.
Yeah, so it comes in capsules and it also comes in tablets. This formulation might be a little bit better. You also just want to make sure you're taking it while you're sitting upright and not laying down because it can cause esophageal problems. So like if you lay down, the reflux can be really bad, or if the tablet doesn't actually make it to your stomach, it can hurt your esophagus. But
Is that why I'm getting like abscesses on my throat?
are they treating your abscess with that? Because it's
no,
not going to cause an abscess. It would be more like pain, like heartburn type thing.
I don't remember getting that kind of pain.
Right.
But,
So then you're fine.
but they gave me clindamycin gel
Okay.
to put on like this abscess, and there's one in my groin area.
Right.
But they gave me the doxycycline to get rid of the infection.
Right. That makes sense. That's a good one.
So I'm also trying to understand like what exactly should I be eating while I'm taking this medication.
What do you mean? You really whatever you like.
Because I was told like the medication, it gets rid of everything in your body, like the good bacteria.
Right.
And,
So you're wondering like a probiotic then?
I don't know.
Some people would like to use probiotics. Some people they don't work. It makes the nausea worse. Like if you have a sensitive stomach. If you'd like to put more good bacteria back into your body because you are on a lot of antibiotics, then you can do that. I can show you some if you'd like.
But what was I gonna say? Because I don't know what's the difference between good bacteria and bad bacteria, but I always thought bacteria was just bad in general.
So your body has like good flora or bacteria that lives in your digestive tract, which helps like your whole digestive system. So when you take an antibiotic, it's killing the good and the bad. So they say that if you take a probiotic, that puts the good bacteria or good flora back into your system. And it just helps with like diarrhea, bloatiness, that sort of thing sometimes.
So is there anything I could eat to get like what they call like ghost poop, where the poop comes out dry and it doesn't, it's not like really messy? Because I'm literally running through a box of wipes, like a 960
There's not
thing
really
of wipes
anything that will make it
every
like
week.
More solid. That's just your body responding to it and getting rid of everything. I mean, you can try like yogurt to help with like the bacteria, like putting good flora back in, and that might help with like the diarrhea part. Or you can try a probiotic, but there's not anything that's going to give you a formed stool. If that makes sense.
So if I wasn't taking this medication, what foods could I be eating to where I would get that ghost poop, to where it just comes out dry and clump at once, not all slimy and nasty?
Right. I have no idea, honestly.
It's costing me a lot of money just to be able to clean myself properly and not worry about getting an infection in my lower extremities. You know what I mean? Like it's really that bad. Like like sometimes like I feel like I have to fart, and I fart a little bit and I'd end up pooping on myself.
Yeah.
And I won't even realize it until
that's more of just the antibiotic upsetting your stomach, though. So they just, I mean, most of the time you can do like a brat diet, which might help soothe the stomach, which is like bananas, rice, chicken, everything is just very plain.
It's called brat.
Yeah.
Like BRAT.
Yeah, I think it's BRAT. Yeah, like plain oatmeal, anything that's just like gonna sit well in the stomach. So like plain oatmeal, plain chicken. You can do fish too, rice and bananas is what they say.
Yeah, 'cause I didn't know what to do. I mean, I started just eating baby food.
Yeah.
Like literally, you know, those the little baby food trays.
Yeah, that's not enough nutrients though.
Yeah, I just started getting that, and then Gerber baby food, Gerber apple juices and pear juices, and then I was getting the healthy choice dinners, the steamers.
Yeah.
And then putting those in the microwave, and then putting the baby food, mixing it with it, hoping that it'll fix the problem.
Yeah.
It tastes disgusting though.
I mean, that probably is good in a sense that your stomach isn't having to like work harder to like you're giving it a break, which is the same thing as what the brat diet is. It's like you're trying to just help it from having to like digest spicy foods and all like the things that are harder to break down. So if you want to keep doing that, you can. I think that if you just make like a big pot of rice and just eat off of that and chicken for the next couple of days, that should help.
What was I gonna say? Yeah, I noticed once I started eating the Gerber baby food, my poop started smelling like dog poop.
Yeah,
Like it was the exact same
it can
smell.
definitely do that.
Why is that?
It's just the whatever they put in baby food.
It
I
smells
think.
exactly like dog food. Like if you ever like seen somebody walking the dog.
I
And
have a baby and it smells
exactly
I know.
like dog. I was like, did I just eat a dog? Like,
No, that's what they say. That it can, and it's basically what you're eating is what changes the smell of it. So it could just be like the type of like food that you're taking. If it does smell, then I would definitely talk to your doctor about maybe trying a different antibiotic. Like
I noticed. I noticed yesterday though. I think it was like the 10th dose of the doxycycline that was prescribed by my primary care physician. I noticed when I had the diarrhea, it didn't have a smell at all.
Yeah.
So I thought maybe, okay, it's starting to work now because now my poop doesn't even have a smell. It's just really watery.
Yeah.
And it was like orange.
So are you using, what are you treating with this? It's like a skin infection or like the abscess you were talking about?
Hidradenitis or something like that. So it's pretty much like an abscess like this.
Yeah.
There's one in between my groin area. Then I've got like some little lumps that are superficial underneath my armpit. Like in my chest area and stuff like that.
Okay. So this is probably going to be like a maintenance dose for you then. So you're probably going to have to stay on this for a while.
Yeah, so I took one full regimen of it already about a month ago. Now I'm on my second regimen. I think I've got like maybe 10 pills left in the bottle. And then once I finish that, I'm assuming I'm going to have to take this right after.
Right.
So I guess... Yeah, so I have this ready as soon as I finish the second regimen.
It's
so is that
also
safe
like
though?
quality of life. If you don't want to be like doing all of those things and this is what's causing you the problems, then I would talk to your doctor about it.
Because I was also told like it's not good to take that much antibiotics at once because it kind of like it ruins your immune system or something, weakens your immune system or something.
So that I probably wouldn't agree with, but it can cause, like I was saying, not damage, but like
Gets rid of all the good bacteria.
right, problems with the digestive tract. So if you are on the antibiotic for a long time, then I would definitely like supplement with like yogurts or something like that to try and get some good bacteria back in there.
But I noticed also I started getting like a really sharp pain on the right side of my head.
Yeah,
out of
are you
nowhere.
drinking enough water?
I'm drinking a lot of Gerber juice and Powerade.
Okay, I would probably try to add some water in there too, and just stay really hydrated because that could probably come from like dehydration, the headache.
Okay.
Yeah.
All right. And then, so if I was gonna buy some food right now from Publix, what's the best thing to buy?
I would get some. I would probably just do like bananas, rice, and chicken, and see if that helps.
Interesting. Okay.
Yeah.
Could I get it from the deli?
It's all going to be on the other side, I think. I don't normally work at this Publix, so I'm not sure exactly where it's going to be at. But I think produce and meat and stuff are along that back wall over there.
Because it. I don't. I'm at a guest house right now. I'm waiting
Yeah.
for my property to be ready. And like, it's gonna be ready in like a month. So all I have is like a microwave and a small fridge in the guest house where I am.
I would check in like. Do you have like a freezer? Okay, I was gonna say I would probably check and like try and see if they have those like dinners, but with like just chicken in them.
Okay.
Chicken and rice or something like that. Sometimes they'll do like broccoli,
Yeah,
like chicken, rice, and broccoli. You were saying the healthy choice.
Yeah. So what I've been getting was the pasta chicken. It's called pesto pasta chicken.
Yeah.
I get that, and then now I just started getting that and the rice, chicken, and shrimp.
Okay. I would
healthy
probably
choice.
see if there's something that doesn't have like a sauce on it, and
Yeah, they
it's
both-
just like a rice.
The chicken and shrimp has a red sauce, and then the pesto pasta has like this green creamy sauce.
Right. Yeah, I would just try and see if they have like just a chicken and rice option, and do that, and then maybe like a banana,
Okay.
and then a lot of water.
Okay.
Yeah.
All right. Thank you,
You're
Lauren.
welcome. Hopefully you feel better soon.
Thank you, man.